In this video here, we're going to take a look at facial scanning. On the left-hand side of the screen, you'll be able to see the probe position and the ultrasound machine. On the bottom of the screen, we're going to put up some images with labels so that you can see the type of structures that we're looking at. So we're going to start with the lower face, and essentially with ultrasound, we're going to be looking from the most superficial layers to the deepest layers. So right at the top of the screen, we have the ultrasound gel, the epidermis and the dermis. We have the superficial fat in this region here. We have the masseter muscle to the left of the screen as it is up here on the patient. And on the right of the screen, we've got the facial artery, the DAO muscle, and deep to them is the buccinator muscle. So if I go ahead and play this video now, we're going to see the lower part of the face on this person. So this is our DAO muscle. This is the facial artery, or a branch of it there. We have the superficial fat. The first white line here where my laser pointer is the SMAS. And we have the buccal fat here with the facial vein around this area also. Now as we come up towards the patient's anterior part of the lower face there, we see the facial artery. We can also observe the masseter muscle. So the patient's just clenching their muscle now. We can see this is the masseter muscle bulging. Above the masseter muscle, we have the parotid gland, and we could also just see part of the transverse facial artery coming into view here. So that's the transverse facial artery, or part of it just up here that we're seeing. Now, if we take a look in the temple area, I'm going to pause the video for a moment, and we'll be able to see the layers in the temple. So we have the most superficial layers being the superficial temporal fascia. We have the deep temporal fascia here, so in between those two is the fat pad. And then deep to the deep temporal fascia, we have the temporalis muscle. And within the temporalis muscle, we'll be able to see the anterior branch of the deep temporal artery, which is this red section here with the color Doppler shown. We can measure the distance of the deep temporal artery down to the bone, especially important in that swift point. And we can see at the moment the patient is opening and closing her jaw, so you can actually see the slide of the temporalis muscle. If I unpause this video, we can watch here the slide of the temporalis muscle. Now this patient has some temporal filler, so if we keep an eye out in a moment, we're going to see this section right here, this dark section here, and this dark section down here is HA filler. So this is the appearance of HA filler in the temple. This temple filler was injected deep onto the bone, and so basically the injection was done deep here onto the bone, and the filler spreads out along the path of least resistance into the muscle, into the temporalis muscle belly, and this is the common pattern that we see for deep temporal HA filler injections. So now with the, if I just skip back to where we were, so now with the color flow on, we're looking at the anterior branch of the deep temporal artery here, and we can see its proximity to the previously injected dermal filler. And so with this view here, we're able to see exactly where that filler goes. And the color flow is just going to show up anything within that box there. Now, if we want to have a look a little bit more superficially, we can have a look. I'm bringing the probe a little bit posteriorly, and we're going to see the superficial temporal artery right up here. So we need to move the color box up a little bit higher. We've come back in towards the hairline of the patient, and we're seeing the short axis of that superficial temporal artery. Now, if we look down here at the probe, it's been rotated about 90 degrees, and we can now see the long axis of the superficial temporal artery. There it is there. Moving along into the mid-face now. So we have the probe in the position just lateral to the nose. And on the bottom of the screen, we've got the labeled image. So the deepest part here is the maxilla bone. We have this black area in here is going to be a piriform space. And we should be able to see the angular artery above the piriform space. And potentially there might be some branches down within that piriform space. So this is one patient who has not had any dermal filler, whereas in the case above, you'll see in a moment, the patient has had some dermal filler injected in the piriform space, and we can see these little dark sections of dermal filler. So HA filler is got a high fluid content, so it appears dark on ultrasound. So this is the maxilla bone. This is the LLSAN muscle fibers. This grey structure here is the superficial fat pad, and we have the deeper fat pad in here as well. So let's go ahead and play this video, and we'll point out the angular artery here, and we can see the piriform space, and notice how much black area there is here. This is all HA filler, and it becomes obvious as we move the transducer around. You'll be able to see down here in a moment more little deposits of HA filler. We can see them there, see them there. We can even see some superficially, which was probably some past cheek filler. Now with the probe along here, we've come lateral, and we're going to have a quick look into the infraorbital foramen. So that gap in the bone between the orbit and the maxilla is the infraorbital foramen. So we're able to pick up the blood flowing from the infraorbital foramen there. And then we're just coming back down into that piriform space, and we can see all of that HA filler. There it is there, coming up through the arteries. So in this position, we're able to see the location of the arteries, we're able to see the location of the bone, we're able to see the location of the filler as well. And once again, if we scan laterally, we'll be able to see that. That's the infraorbital artery coming out there. We've got another little bit of filler just here. There's the angular artery and that a bit of filler in there. All right, now we're going to turn the probe 90 degrees. And with the probe at 90 degrees, we're going to get a cross section through the face here. So we've got the nose towards the midline. This is the cheek out here towards the lateral part. And in this space again, we can see the filler in there next to the nose, this dark area here. And we can also see the angular artery running on top of it. And if we move the probe up high enough, we'll be able to see a little gap in the bone here and part of the infraorbital artery. So it's always good where possible to try and scan in both planes, the long axis and the short axis, to give a proper three-dimensional view